wide project, and also the project doing only in Shanghai. Before talk about these projects, I should introduce the BSc study, very famous study doing in Shanghai. And this was a over 10 years study. And this study result out that BSc cannot be a screening method worldwide, but I think it's really can improve our awareness. And in the country with limited resources, we can use this method to increasing the awareness and encourage women to take part in the screening program. And for these 5 projects, we have some preliminary results. Because of the time limitation, I cannot introduce in detail of these results, but I show you some results. For example, for the detection rate, we have a outpatient opportunistic breast screening, and also we have an employee-paid woman examination. And this is a very good policy in Shanghai and also in China. It is said there is a regulation that all the women employed by the by like factory or company or a school or government agency, and the employer should pay their woman examination, include CBE, include pap smear per 2 years for them. So also we collect the data from this program, and also we initiate a community-based breast screening using mammograph and ultrasonic, and also I mentioned the 2 nationwide project. We can see the detection rate, the outpatient opportunistic screening is quite high, and the community-based is also quite high. But the CBE project is quite low. It is almost as same as the incidence of the population incidence at the same age group, a little lower than the population registered data. And also the stage proportion of stage 0 to 1 is, and the CBE is the lowest, is as the same as the population registration data. And the community-based mammograph and ultrasonic is about 55%, and the employee and the outpatient program is quite high, is 83%. And also from our project, we can see those major findings. And also I think a very good result is that we proved that the community-based mammograph and ultrasonic screening can downstaging 23% of the can downstaging of the O and the 0 to 1 stage. But it is very expensive. The direct cost for per detected case is about $13,000. And also we can compare the different method of the sensitive. For the Chinese woman, we have more dense breast, so we find mammograph plus breast ultrasonic showed ideal sensitivity. And also we find that CBE as a screening method need more evaluation, and also for the mass screening, even mammo plus ultrasonic is good good result, but the cost-effective evidence show it's too expensive. And also for the opportunistic screening, we need a very good definition of the risk factors in our population. So for our national guideline development, we think we should consider the level of resources in China, because China is so big. In different places, they have different economy level and different medical resources, and try to make it accessible, feasible, and cost-effective. Finally, those are our superstar. Every year, this fashion magazine will do this activity to let these superstars say, "We love breast. We should stay with fashion and stay with health." Thank you.